Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Carolina Duth and I'm a member of CADCA's Evaluation and Research team. If you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. CADCA, along with its Geographic Health Equity Alliance and in partnership with CounterTools, are excited to offer this special edition in the webinar series on minimum floor price laws, which are a great non-tax policy option for not only tobacco, but also other substances. CADCA's Geographic Health Equity Alliance, or GHEA, is a CDC-funded national network dedicated to reducing health disparities related to tobacco and cancer. GHEA's focus is on reducing geographic health disparities, which they define as the differences in health behaviors, outcomes, and policies related to where people live, work, and play. For more information about GHEA and promoting health equity, visit geohealthequity.org. CounterTools is a 501c3 nonprofit organization that provides training, technical assistance, and software tools to advance place-based public health and health equity initiatives. CounterTools also manages countertobacco.org, a CDC-funded resource focused on tobacco point-of-sale history, impact, and policy solutions. I'm joined for this installment by Dr. Shelley Golden and Derek Carr. They will present on their article, Simulating the Impact of a Cigarette Minimum Floor Price Law on Adult Smoking Prevalence in California, which was published in Nicotine Tobacco Research in 2020, and will discuss how coalitions can effectively implement non-tax pricing policies to impact tobacco or other substances. And now I'd like to introduce our presenters, Dr. Shelley Golden and Derek Carr. Shelley Golden is an assistant professor in the Department of Health Behavior at the School of Public Health at the University of North Carolina at Chapel Hill and a member of the UNC Lineberger Comprehensive Cancer Center. Her research focuses on the political and area-level conditions in which individuals and policymakers make decisions that impact population health. Most of her current work focuses on tobacco product price policies, especially those implemented at the state and local level, and other aspects of the tobacco retail environment. Dr. Golden received her Bachelor's of Science in Biology from Yale University and her Master's of Public Health, as well as her doctorate degree in public policy from the University of North Carolina at Chapel Hill. Derek Carr is a senior attorney at ChangeLab Solutions, where he works primarily on issues related to substance use and addiction, including commercial tobacco control, as well as on preemption and health equity across issue areas. In this role, he has provided legal and policy technical assistance to state and local governments, public health professionals, and community-based organizations on topics such as point-of-sale policies, drug overdose prevention, preemption, the First Amendment, and health equity. Prior to joining ChangeLab Solutions, Derek was a legal fellow at the Network for Public Health Law, where he helped develop legal and policy interventions to reduce drug-related harm, and a legal intern at the National Health Law Program, where he worked on issues related to healthcare access and Medicaid. Derek received both his bachelor's degree in public policy and political science and his law degree from the University of North Carolina. Now I'll turn it over to Mr. Carr to begin.
Great, thank you, Caroline. Happy to be here with you today and looking forward to this presentation on minimum floor price laws, an emerging strategy to reduce tobacco-related socioeconomic inequities. Now, before we get started, I have to give you the spiel. I am a lawyer. I am not your lawyer. And at ChangeLab Solutions, we don't provide legal advice or enter attorney-client relationships. So this presentation is for informational purposes only. And we have an exciting and packed agenda today. We'll first answer the question about why we're talking about tobacco pricing policies in the first place, and then a little bit about the different types of tobacco pricing policies and the benefits and drawbacks to those. Shelley will then discuss the California minimum floor price model that we developed for state and local stakeholders in California. And we'll conclude with a discussion on some of the equity, legal, and public health considerations to keep in mind when designing, adopting, and enforcing tobacco pricing policies. So why should we focus on tobacco product prices at all? So as all of you are aware, the commercial tobacco control movement has made some truly incredible progress in reducing smoking rates and tobacco-related harm over the last few decades. And while the graphs on this slide are specific to California, we've seen varying degrees of decline across the country as well. But we also know that these gains have not been evenly distributed across the population. Stark racial, socioeconomic, and other disparities in tobacco use and tobacco-related harm persist. And we've been able to narrow some of these gaps, but other disparities have actually grown larger over time, including disparities based on socioeconomic status. And again, while these graphs are specific to California, similar inequities exist across the country across demographic factors like race, sexual orientation, geography, and education. So two things are really clear. Our work is far from complete in commercial tobacco control, and that we must be deliberate in choosing strategies that squarely address these inequities. So for anyone who's done store surveys, you can attest to the widespread availability of cheap tobacco products. And we know that price discounts are core to Big Tobacco's playbook. They engage in the predatory targeting of underserved communities with these promotions and discounts. For example, a study found that communities with higher proportions of Black high school students had menthol prices which were lower, and menthol advertising is more prevalent. And while pricing strategies are effective at reducing tobacco use across all populations, the evidence is also pretty clear that they can produce outsized benefits for many underserved communities. That is, they can produce greater reductions in tobacco use and related health harms among many of the populations experiencing health disparities and inequities. So we know that pricing policies work as a general matter, but what types of policies are most effective? Up until relatively recently, tobacco pricing policies occurred overwhelmingly at the state and federal level. And excise taxes are the gold standard for increasing the cost of tobacco products. Every state and the federal government impose tobacco excise taxes, and these taxes provide critical funding for government services and in some cases tobacco control programs. Unfortunately, many states preempt, that is, prohibit local governments from enacting additional local tobacco taxes. And other states, even where it's not preempted, require that any taxes be approved by voters via a ballot measure, which can be prohibitively expensive to pursue in many areas. But of course, that's not the end of it. There's plenty that can be done at the local level in many states. And these revolve around three core policies: establishing minimum floor prices beneath which no product may be sold, prohibiting the redemption of coupons, discounts, and promotions, and establishing minimum package sizes. So this first policy is really like three policies in one, and requires retailers to establish a set price for each tobacco product, and then prohibits them from accepting coupons allowing for the purchase of products below that price, selling tobacco products via any type of discount or promotion that drops them below the base price, or giving away anything for free or at a discount with the purchase of any tobacco product. So things like, buy one pack, get one free, or buy a pack of cigarettes and you get, a t-shirt or something. And the purpose of this policy is to eliminate price discrimination by establishing a uniform policy. And it diminishes the tobacco industry's ability to capture more sensitive consumers like youth and individuals with lower incomes. Minimum package sizes are also important and relatively common. Now, it may seem counterintuitive to force people to buy even more tobacco, but the idea is that by requiring, for example, little cigars to be purchased in packages of 20, the cost for that will be higher than a single little cigar and thus raise the barrier to purchase. And this is especially true for youth who might not have as much money available. Which brings us to the key focus of the presentation today, establishing a minimum floor price. Minimum floor prices do exactly what the name implies. They set a floor beneath which no tobacco product may be sold. Just as one example, Sonoma County became the second jurisdiction in the country after New York City to adopt the minimum floor price law, prohibiting the sale of cigarettes, little cigars, and cigars for less than $7. And it's also important to consider these policies as sort of puzzle pieces that all fit together to accomplish a larger task. They fill different gaps and protect against different industry tactics, And they all also aid in the enforcement of the other policies. So for example, effective minimum floor prices depend on set package sizes and the inability to use discounts to undermine that floor price. So while each of these strategies can be enacted on their own and would still certainly have an important public health benefit, this is one of those cases where it is truly where the full package is greater than the sum of its parts. Now, I won't cover this slide in depth, but I just wanted to provide a quick snapshot of local minimum floor price policies in California. We can see the progression over time on those policies, and this slide will be available after the presentation. And then New York City provides a really great case study on the evolution of minimum price policies. Although their original policy was more limited, primarily focusing on cigarettes, they expanded their policy in 2017 to include nearly all tobacco products, with the one exception of electronic smoking devices. And this expanded policy included a couple important innovations. First, the law established minimum pack sizes for smokeless tobacco, snuff, shisha, and loose tobacco. And second, rather than setting a single minimum floor price, New York City's law specifies a baseline floor price and then an additional minimum based on the quantity of the product being sold. And this approach prevents tobacco companies from simply selling large quantities at a low price as a loss leader, and serves to increase the impact of the overall minimum price policy. And we also know that minimum floor price laws have a potential health equity benefit. A study looking at the impact of tobacco control interventions on socioeconomic inequity, authored by Dr. Golden, found that price increases were the single most effective policy strategy for reducing those inequities. In fact, studies have shown that minimum floor price laws may be even more effective than excise taxes at reducing tobacco-related inequities, because they target the cheaper products on the market that are disproportionately used by youth and some underserved populations. And with that, I will turn things over to Shelley to talk a little bit more about it.
Great, thanks, Derek. So hopefully by now, Derek's convinced you that there's some value in non-tax-based price policies, especially floor price laws, as kind of an important complement to tax-based pricing policies, as well as that, they are being implemented, and so they are feasible in some places. I'm going to build a little more on the argument that he's put forward about there being floor prices being potentially pro-equity policies. As Derek referenced, sort of previous work suggests that price policies in general can reduce disparities in tobacco use, especially socioeconomic disparities. And the argument behind that is usually that lower income populations are sometimes more price sensitive, so they're more willing to change their behavior in response to changes in prices. But I want to talk specifically about floor prices as having sort of an impact even beyond that. So with these slides, I want to try to illustrate my argument. So here on this slide, imagine this is a picture of a simplified tobacco market where within any given tobacco product category, there could be different price tiers, which are shown here from left to right. So there might be discount cigarettes, which on average cost some amount less than sort of the value range cigarettes, which cost less than the premium cigarettes, etc. In addition, within each price tier, we recognize that consumers can pay different amounts, maybe based on what brand they choose, but also what retailer they shop at and what prices the retailer sets, and whether they use coupons or discounts. So this is reflected on the graph by the height of the gray bar within each tier. So on the next slide, we illustrate sort of what we anticipate happening with cigarette taxes. So most cigarette taxes in the United States are what are called specific excise taxes, meaning that they raise the price of the product, like a pack of cigarettes, by a certain set amount. So in general, what you see is perhaps that the entire market just shifts upward by the amount of the tax. Floor prices, on the other hand, we illustrate on the next slide. What we see happening with floor prices is that they create a flat bottom to the pricing market, sort of regardless of the pricing tier. And so depending on what actual floor price is set, it's possible that this approach might actually not alter the prices of the premium bands much at all, but could drastically increase the prices of cheaper cigarettes, maybe even if set high enough, price some of the discount brands out of the market entirely. All right, next slide. So why might this impact socioeconomic disparities in tobacco use? Well, let me start by saying that evidence is far from conclusive. However, there are some studies that suggest that lower income smokers may pay less for tobacco products than higher income smokers, or that prices might be cheaper in lower income neighborhoods than they are in other places. And so therefore the products bought and the prices paid by lower socioeconomic smokers may be more impacted by a minimum floor price law. All right, next slide. So this brings me to the study that I was invited to discuss today, which was referenced earlier. It focuses on building a minimum floor price model for California. All right, next slide. So in this study, we wanted to create a model of how different options for California-specific cigarette minimum floor price levels might impact prevalence of smoking as well as cigarette consumption. And we wanted to think about this both overall for the entire population, as well as for different socioeconomic population groups. And I just want to note at the outset that this is a model that's built for California in general, the entire state. A lot of what Derek talked about were that floor price laws are also relevant and really actually have been implemented more at the local level. We built a California-specific model in order to then develop local models from there. So the process that I'm going to talk about is one that could be adapted to local levels as well. All right, so next slide. All right, so how did we go about doing the study? Well, this was a study that we conducted by building a microsimulation model. And what a microsimulation model is just the application of a set of rules to a simulated group of people, so that have specific characteristics. And so by applying these rules to this group of people, we can observe what happens as we change the rules a little bit over time. And so in our tool started by building a simulated population that was really meant to look like the population of California. In particular, we matched the demographics of the adult population of California along several dimensions of gender, age, race, ethnicity, and poverty status. And then we used data from the California Behavioral Risk Factor Surveillance System to determine of that, to sort of create that population to determine who smokes, how many cigarettes the smokers smoked each month, and what they pay for a pack of cigarettes. So essentially, because each of these things vary by demographic characteristics, we looked in the data to determine how sort of the demographic distributions of each of these things, of smoking status, consumption, and prices in the BRCSS data, and then assigned our simulated sample smoking behaviors and pricing behaviors based on what we'd observed in the behavioral risk factor surveillance system. And then one other thing we needed to do is California passed a $2 increase in their state cigarette excise tax in the time in between when the data was collected, the BRCSS data was collected, and from when we were doing our study. So we adjusted prices to account for that. And also made some adjustments thinking about different areas within California and how prices might differ. All right, next slide. So our next step was to choose sort of floor price options, like different policy options that we wanted to model. And so as has been done in New York City and elsewhere, we started by looking at what the sort of current or pre-policy distribution of prices were in California. And so what you'll see is, again, from that reported data on prices, people paid a range for their pack of cigarettes, averaging about $7.64 per pack. And so on the next slide, we identified floor price options that we thought might be politically plausible. So we picked a few that were kind of just below and a few that were just above that average price. But then we decided to also model a couple of reach options at the higher end of the market, so the $9 and the $9.50 prices are up there. All right, next slide. So to model change following the implementation of any of those floor prices, we had to make some assumptions. And so first, we assumed that when we regulate and put a floor price into place, the people who were previously paying below that floor price would now pay that floor price instead. So they'd sort of go up to the minimum that they would have to pay. And that the people who'd been previously paying more would just keep paying more like they had beforehand. That said, our model does take into account the possibility that consumers might find ways around the policy, maybe by shopping in another district or shopping on the black market, et cetera. So we build in a little bit of assumption that maybe some people manage to get around the law. And then we used estimates that have been established in the literature about how people tend to respond to changes in cigarette prices in order to determine how the price changes that we're modeling would impact smoking prevalence and cigarette consumption. Okay, next slide. So what did we find? Well, let's start by looking at the impact on prices. So on the x-axis here, you'll see the different floor price options that we modeled. And the black line simply represents the sort of pre-policy, that average price of $7.64. And then what we find on the purple line is that if we choose floor prices just below sort of an average price, so if we chose the $7 floor price or the $7.50 floor price, the average price in the market does go up by a little bit, but not a ton. On the other hand, if we choose higher floor prices, not surprisingly, the sort of average price that people pay goes up by a decent amount. So in purple here, you'll note it also says no avoidance. So we started by modeling what would happen if everybody was compliant with the policy, but then we also wanted to look at what would be different. And so on the next slide, we build in a few assumptions around avoidance. And so on the yellow line here shows what happens if about 7% of the population avoided the policy in some way, and the sort of teal line shows what happens if about sort of about 15% of the population avoids the policy. And so what you'll see is that definitely the policies have less impact when there is avoidance, but the difference, even with these assumptions built in sort of what the impact is, relatively small compared to the overall changes in prices that we observe by implementing the policy. All right, so next slide. So then how do these changes in prices translate to changes in smoking prevalence? So if we started a prevalence of just over 10%, which was about what California's prevalence was when we started this, we definitely see reductions in smoking for all of the different floor prices under the assumptions of no avoidance. And then the next slide will show the under the assumptions of some or more policy avoidance. So next slide. Yeah, so again, you see this sort of pattern now working in the opposite direction, where it makes sense at higher floor prices we hit larger changes in smoking prevalence, and that even building in some assumptions about avoidance don't change that a whole lot. So on the next slide, we sort of tried to measure what this might mean in terms of people. And so to put this another way, if you look at that $8.50 floor price, so this is, you know, above the average price, but not sort of at our reach level prices. We calculated that the change in the floor price would result in about 84,000 fewer smokers in California. And obviously this would be even higher if you picked one of the higher floor prices. So these are the models of state smoking prevalence. I'm not going to show you the pictures of cigarette consumption, but they follow really similar patterns where you'll see sort of a curved line bending downward in terms of the number of cigarettes that people smoke per day. All right, so what about the possible impact on socioeconomic disparities? So let's go to the next slide. So we ran our model specifically for two population groups, those that were living in households below 250% of the federal poverty level, and those who were living in households at or above that. And so what I'm showing here on the left is just for the $8.50 floor price, so the same one that I just illustrated a second ago. And what we see here is that you do see that prices go up more and consumption comes down more among the group living below 250% of the federal poverty level as hypothesized. But it's important to put this in perspective. So next slide. So the current disparity in smoking prevalence in California, when we did this work, is quite large. So what you see on the right here is now sort of the blue line shows sort of the projections from our model for those living in households under 250% of the federal poverty line, and the red shows the projections above. And if you look closely, you will figure out that the blue line sort of slopes down a little bit faster. And so, you know, at the $9.50 floor price, just, you know, the difference between those two lines is smaller than it is pre-policy. However, because the gap is so big to begin with, this is really only sort of a partial solution and might only be you know, one piece of, you know, a comprehensive model that's trying to look at socioeconomic disparities. All right, next slide. So as with all research studies, there are sort of limitations to our work. First, we only modeled cigarette use and presumed that responses to price changes would be to quit smoking. So yet some people actually might respond to a cigarette price policy by changing to a different product, like little cigars. And so, you know, Derek mentioned earlier New York City's policy that really tried to create floor price laws across multiple products. That's sort of a recommended strategy to really try to encourage reduction of tobacco use in general rather than product switching. But we only focused in on the cigarette piece here. Second, we only modeled adults and not youth, and we can maybe talk about that decision a little bit later. Third, this model focuses on sort of short-term changes. So, you know, when we expect a price change or things like that, other things might come along over time. So retailers may respond to price changes by doing certain things, but also places implement other policies and other things along the line that would create impact. And we really took a short-term look at this rather than a long-term. We also don't project long-term health outcomes. There are a decent number of studies of tobacco taxes that do that. And what's really different about a floor price is just how it changed prices. And then a lot of what happens after that's pretty similar to what happens with taxes. And then finally, of course, as I mentioned, this is a California specific model. So on the one hand, this was, I think, a strength because we were able to use California specific data, which made it really relevant to the area we were looking at, and we were partnering with folks in the California Tobacco Control Program as part of this work, so that was useful. But of course, means we can't necessarily assume that what we predict for California would be the same elsewhere. One way to think, though, about like what the impact might be in a different locality or a different place is to look at the distribution of prices that people currently pay or that are available in different neighborhoods. So you could sort of get a sense of to like which prices, which retailers, et cetera, would be most impacted by a floor price law. And also if that distribution at all looks similar to California's, then you might expect some similar results. All right, next slide. So I just want to wrap up by, I know they're going to share these slides. These are a couple additional studies that might be of interest to folks who want to learn more about research into the potential impacts of these policies on pricing and use. But I'm going to turn it back over to Derek, who I think is going to talk more about additional considerations related to implementing floor prices.
Thank you, Shelley. So given that landscape, what are some of the equity, legal, and public health policy considerations that are important to keep in mind when pursuing or enforcing local tobacco pricing policies? From an equity perspective, it's important that we acknowledge and own that tobacco pricing policies are regressive. We can't avoid that or just try to sweep it under the rug. And this means that low to moderate income individuals will pay a higher percentage of their income towards increased prices compared with higher income individuals. And this can impose a significant financial burden on low income smokers and to the extent that these people who smoke continue to smoke, higher tobacco prices decreases their purchasing power for other goods and services needed for their daily lives. That said, any conversation about regressivity should frame the issue in the broader equity context of tobacco use. That is, framing it around the tobacco industry's consistent and pernicious targeting of its products disproportionately to underserved communities and youth. And this contributes to tobacco-related harm being experienced disproportionately or regressively by these communities. Because increasing the price of tobacco products has been shown to have a significant effect on consumption, as Shelley just outlined, that means to also provide disproportionate health benefits to some of these communities. And of course, as with all policies in tobacco control and elsewhere, we have to remain mindful that they're enforced equitably. This includes considering things like people's ability to pay fines, the impacts of a person's immigration status, and honestly, the broader context of the current and historical targeting of many communities of color by police. And policies, of course, they must be enforced rigorously in order to be effective, but at the same time, it's imperative that we ensure that enforcement doesn't create new inequities or exacerbate existing ones. So there are also a handful of legal and policy design considerations to keep in mind. The first is the First Amendment. And in the context of tobacco pricing policies, communities need to be careful to steer clear of the First Amendment when designing those policies. And the key thing to remember here is to focus on prohibiting the redemption of coupons and discounts rather than on prohibiting distribution. So you want to focus on the regulating the actual commercial transaction rather than say like the advertising of particular products, and the distribution of coupons falls under that sort of window or umbrella of speech. Second, with minimum floor price policies, you want to make sure that the policies include language to automatically adjust the minimum price annually based on inflation. And this is to ensure that the effectiveness of the policy doesn't diminish over time. Online sales is also a really tricky issue. It's something that's come up with increasing frequency, and it's a tough issue to tackle at the local level. And that's because although cities and counties generally have the authority to regulate sales occurring within their jurisdiction, it's difficult for them to take enforcement action against retailers located outside their jurisdiction or even outside their state. Next, as Shelley mentioned, we know from decades of research on tobacco taxes that if you increase the price of one product, consumers will often just switch to similar but less expensive products. Something analogous occurred with flavored cigarettes, with tobacco companies shifting to flavored little cigars following the federal ban on flavored cigarettes in 2010. And the important takeaway from this is exactly what Shelley said, and that is that local tobacco pricing policies need to ensure that the policy covers the full array of products in order to minimize the potential for substitution. Next is considering the impact on retailers and potential retailer supports. And there are two different main things I want to convey here. First is that, unlike in many areas of retail tobacco control, retailers may actually be a key ally in supporting minimum pricing policies because unlike taxes, they actually get to keep any additional revenue from the increased prices. And there's a possibility that even if overall smoking prevalence declines and sales decline overall, that the increased margins on the products they do sell will sort of offset that. And then also, jurisdictions should consider offering support to smaller retail looking to shift their business model away from tobacco as a result of new policies. And this can be anything from healthy retail programs to key discounts to more creative approaches as well. And then finally, it's important to provide increased cessation services, particularly among lower income populations that will be disproportionately affected by the price increases. Next, I just want to highlight a few resources. I won't go through them in depth, but I just wanted to flag them in case they're helpful for you and so that you have them when the slides go out. So the first resource is ChangeLab Solutions Comprehensive Tobacco Retailer Licensing Model Ordinance, which includes language for all three of the pricing policies we've discussed today. And while it's designed specifically for California cities and counties, many local jurisdictions in other states could adapt it for their use as well. And I'll also plug that the Public Health Law Center also has both general and state-specific model ordinances that can be of use too. You can also find a variety of guides, playbooks, infographics, and other downloadable resources on the ChangeLab Solutions website. And this includes a fact sheet and infographic that we developed in partnership with Counter Tobacco. The resources cover the rationale for tobacco pricing policies, the different policy types, relevant considerations, and available resources. And the infographic in particular is well suited to provide to community members and policymakers who might not have the time or inclination to read a more lengthy document. And the final two resources, while they're not specific to tobacco control, might also be of interest as they're focused on health equity more broadly. The first, A Blueprint for Changemakers, presents legal strategies and best practices to help policymakers, practitioners, and communities improve health outcomes by reversing the fundamental drivers of health inequity. The second, Equitable Enforcement to Achieve Health Equity, addresses how to design and implement policies such that their enforcement doesn't create or exacerbate inequities. So with that, thank you, and I will turn things back over to kick off our Q&A.
Thanks, Derek and Shelley. So we're going to move into the question and answer part of this webinar. First, CADCA will ask Dr. Golden and Mr. Carr several questions, and then we will turn it over to participants to ask their own questions. So if you have a question for the presenters about the presentation, please go ahead and type it in the Q&A box. I see that there are 6 questions in there already, but we will answer as many questions as we have time for, so feel free to continue adding questions while we start with these questions from CADCA. So the first question is, what strategies do you recommend for funding enforcement without the increased government revenue associated with taxes?
Yeah, I'm happy to kick things off on this. It's a great question. Of course, funding, especially during these times when municipal budgets are stretched, it's important to figure out what funding streams may be available. And I think the sort of best practice and most practical way for jurisdictions to do this is through tobacco retailer licensing, where the jurisdiction requires tobacco retailers to obtain a license in order to sell tobacco, and they charge a fee for that privilege. And that fee can be set in order to recover the cost necessary to implement and enforce the program, or to enforce the ordinance. There also may be opportunities for grants at either the state or federal level. For example, here in California, our most recent tax increase included a set aside to support local enforcement activities. And then it's also possible to sort of build these inspections into, or to build these enforcement practices into things that jurisdictions are already doing, like SINAR inspections or health department inspections of facilities. And so you can get creative about where they fit in.
All right, thank you. The second question is, what impact do you anticipate minimum floor price laws may have on youth tobacco use initiation? I know your study was focused specifically on adults, but a lot of our coalitions work with youth more specifically. So we're interested in youth tobacco initiation.
Yeah, so that's a great question. So first, I should say that one of the reasons that sort of analysis-wise we focused on adults is because to sort of do the type of analysis that we needed some information on not just on average what adults paid for or what people paid for their cigarettes, but we needed that information about variation by socioeconomic status. And there are just fewer data sources in which youth talk about or offer what they pay for cigarette products. Conceptually, however, I would say there's probably a little bit of, there's some good things to think about in terms of how price policies impact youth. So there's some research that suggests that youth are actually more price responsive to adults. So they're even more likely to sort of reduce their tobacco use or not start as prices go higher. This is slightly countered with the fact that a lot of youth get their tobacco products from social sources, so from family and friends. So they may not be buying their tobacco in a retail store. And so thinking about that, you sort of have to think about what you know about both of those things happening to try to think about impact. I did read a recent study that argued that prices in general, so they weren't looking at floor prices specifically, but prices in general, that they found that prices did still impact youth even if they were getting their cigarettes from social sources. Excuse me. So I think it is possible that we could still expect results and possibly even stronger results for floor prices related to youth. And like I said, there's some challenges around modeling it. The one other thing I would keep in mind, I think we'll talk about this in a couple of questions here, is, keeping in mind that, we did a model of cigarettes, and that's not the predominant product of choice for youth anymore. And so we would want to be thinking about this equally, if not as much, with electronic cigarettes.
That leads into question 4, so I might skip over question 3 for the time being and jump to question 4. Are alternative pricing strategies viable for addressing other substances such as e-cigarettes, alcohol, or in some states, marijuana?
So I'll start answering this and then probably invite Derek to add. So I think the short answer to the question is yes. The longer answer to the question is that you'll remember that Derek talked in particular about things like minimum package sizing and things like that. Part of the beauty of a minimum floor price is that it sort of sets a really clear price on what a product should be, which makes enforcement of it relatively straightforward and easy compared to sort of pricing strategies that end up really complex or different for different products or that sort of thing. The challenge with e-cigarettes in particular is what the product is and which part of the product you might decide to put a minimum price on. And so, as Derek mentioned, New York City did most of their other products, and they dealt with some complicated products like figuring out, 2 packs of cigars and 4 packs of cigars and that sort of thing. But I think, e-cigarettes present even a larger challenge to that because there's so many variants of how people use e-cigarettes and what products they're using as part of that. I do want to give a shout out to folks who work in alcohol, because the alcohol field's arguably perhaps a little further ahead of the tobacco field in minimum pricing, especially outside of the US. So Australia and parts of Canada, I believe, have had what they often call minimum unit pricing on alcohol for several years. Scotland's had it for a few years, and I think Wales just introduced it this past spring, and it may have passed there. So there are definitely models out there for how this could work for alcohol pricing. And then, marijuana is probably a newer field for us to talk about pricing here in the United States in general. I think, but I do know that there are recommendations to consider minimum pricing as more of it. And I think Derek might have a few other thoughts or resources to share related to that. Hopefully I'm not misspeaking for you, Derek.
No, that's right. And I can send that so that it gets included in whatever goes out. I think there are a few considerations here. One being, apart from the scientific aspect of it and the health policy side of it that Shelley just covered, but also the legal side of it as well. Just sort of building on question 3, the big question for local governments is whether they have the legal authority to enact this or whether the state preempts them, prohibits them from doing so. And that is just as true in the context of alcohol and cannabis as it is in tobacco. There's fairly widespread preemption of local restrictions on alcohol, probably analogous to how widespread tobacco preemption is. So certainly something that folks need to keep in mind if they were to pursue this similar strategies in other areas. And then on cannabis, as Shelley was saying, there are recommendations out there to sort of take the tobacco model and apply it to cannabis with things like minimum pricing and flavors, and also the smorgasbord of potential policy responses. And there are organizations such as Getting It Right from the Start that have produced model local ordinances to do just that. But as Shelley mentioned, the cannabis markets are still in relatively early stages of development. So it remains to be seen if or how prevalent those types of policies become.
Thanks. On that note about getting it right from the start, if any of you were present for the January webinar in this series, we had Dr. Alyssa Padone on, and she currently works at Getting It Right from the Start, actually. So if you go on the CADCA website, you can look for that webinar. It was in January of this year, and hear more about, well, she didn't speak specifically about this, but she did provide the cannabis ordinance, I believe, for participants, so you'll be able to access that on the website. And then, Derek, could you elaborate more on this topic of how can coalitions find out if they can work on local strategies to increase tobacco prices? Because you alluded to it in your answer to 4.
Yeah, absolutely. So again, this question is a question of legal authority and state preemption. And it's not always particularly clear whether preemption exists and whether locals have authority to work on it. So our recommendations generally here are to reach out to your partners in the field that may be able to help you find that information. That includes legal and policy technical assistance organizations like Change Lab Solutions, the Public Health Law Center, Public Health and Tobacco Policy Center, the Network for Public Health Law, among others. You can also reach out to your contacts at voluntary health organizations like the American Heart Association, lung, cancer. In many cases, they're tracking preemption across tobacco preemption across states, and can either directly answer those questions or make connections with other organizations that can do that research. And then the final resource is just your local government attorneys who know sort of the ins and outs of what is preempted and what's allowed at the local level. That is not always a comprehensive approach. Local government attorneys are often risk averse, but it is one more source to sort of build that information from, in addition to sort of the public health law and policy CA providers.
Okay, so we're going to move on to participant questions. So I'll turn it over to Elizabeth for that. Sure. Continue putting your questions in the Q&A box if you have more of them.
Hi, everybody. I'm Elizabeth Gurnt. I'm a project director with Counter Tools, and I'm going to facilitate a couple of these questions from participants. So, Derek, going off of what you were just talking about, we have one question asking for a little bit more information on how a preempted state might be able to implement any part of this type of policy change at a local level. Do you have any insight on that?
Yeah, so it's really a spectrum. Preemption, the scope of state preemption in tobacco and across issue areas for that matter varies fairly considerably. Some states have relatively narrow preemption that is just about, say, like the age of sale, while other states have really broad preemption where local governments aren't able to regulate tobacco products at all, or if they are, it's sort of limited to the secondhand smoke protections rather than on sales and distribution. So if you're in a state that is sort of known to have blanket preemption over all of tobacco policies, it's really difficult, and there's not a clear path for directly working on these policies at the local level in those jurisdictions. But certainly locals can still take action to raise awareness about the issue and advocate for changes. So, documenting all of the low prices and the impacts that are having on population, passing resolutions to support the state extending control over tobacco sales regulations to local governments, sort of just building up that grassroots pressure in order to affirmatively make the case why local regulation is important. But it's challenging and not a particularly clear path forward if there is already that comprehensive preemption in place, unfortunately.
Yes, thank you for that.
And Derek, just to follow up, I think it even more explicitly, I think when you're thinking about non-tax price strategies, some places preempt local taxation, but don't necessarily preempt non-tax price strategies, correct?
Yeah, that's absolutely correct. So in California, the only thing that is preempted in the context of tobacco regulation or tobacco retail sales regulations is excise tax or taxes on tobacco products. And California is certainly not alone in that being the case. Tax law in general is an area with wide-ranging preemption across the country. And so it's often the case that there may be opportunities to do non-tax policies, pricing policies, even where taxes are not a viable approach.
Great, thank you. So we also have a couple of different questions, just again, thinking about the impact of minimum floor pricing on small retailers. Could you speak a little bit more about that? People are asking whether or not that might discourage retailers from selling tobacco at all.
So,
Shelley, do you want to start?
Yeah, I'll start by saying that I don't think we know the answer to the question of what happens to retailers. So in this country, at least, many of these laws have just been put in place pretty recently. And so, the research is not yet cut up on really looking at what the impact is on retailers. Derek offered, I think, one thought that, they may recoup some more profit off of their, off of a floor price law, because the price that goes up may end up in their pocket as opposed to a tax, which ends up in government pockets. And so I think that's a possibility. We also don't know what the tobacco industry, we don't have enough research to know exactly how the tobacco industry responds, and whether or not they manage to sort of pull off, some of that higher amount. So I know it's always dissatisfying when scientists say we need more research around this, but I think that is the answer to this question, is that we're not yet sure.
Okay, and you might not have an answer to this either, but someone's asking if there's any evidence of an increase in black market tobacco sales as a result of policies like this.
So specific to floor prices, I'm not aware of anywhere that's looked at that. So there's been a little bit of research done in New York City, but I don't think they've examined that. There is some evidence of either black market or what's sort of considered, cross-border shopping or things like that in response to price policies in general, although not as much as usually the industry will make it out to be. And so I think what that sort of underscores is both understanding your market to begin with, and how much sort of black market sales happen to occur to begin with. It is likely to be an issue with any kind of price policies, rather than a specific kind over another. And then it also speaks to, while a lot of these policies are being implemented at a local level, there is some advantage to regions and things like that working strategically together, to prevent kind of a patchwork of policies that allow people to kind of work around them as need be. Derek, I don't know if you have anything else to add there.
No, I think that covers it. We should, whenever like tax increases go into place, we do see an uptick in that. But as you said, that is often exaggerated. The scope of that is often exaggerated by the industry. I think there is sort of sufficient evidence to conclude that while that may be a trade-off on some of these policies, that the health benefits from the policies sort of outweigh the potential increase or moderate increase in illicit sales.
A follow-up on the thoughts about a regional approach. Someone's asking if that's a best practice to enact a state level minimum floor price law rather than a local level. Do you have insight on that?
Yeah, I mean, I think it depends, right? Obviously it is always better to have a statewide policy that everyone is benefiting from. That said, there are often more compromises that happen in the state legislative process than happen at the local level, and we certainly, we wouldn't want a relatively weak, minimum floor price law at the state level to preempt, locals from going above and beyond that. And so I think it really depends on how the state would structure their minimum floor price law, sort of that devil in the details bit of it. But as a conceptual matter, it's certainly beneficial to have those policies in place at the state or federal level even.
And I just want to add, to give credit, I think that a lot of the really innovative tobacco control work is happening at the local level right now. And so I don't know if there's a best practice answer or not, but I think if the locals were not doing some of the work they were doing, we wouldn't have some of these ideas for consideration at the state level.
Yeah, that's great. So our next question is thinking about the best first step for initiating minimum floor price strategies, and whether or not it makes sense to do this per product, thinking about vape and traditional tobacco products if you'd set a different minimum floor price for each. So I guess
do you want me to start?
Sure.
Yeah, so I think there are several places to start, and I think it also depends on what other groundwork has already been done, even if not necessarily for the purposes of pursuing a minimum floor price. So things like store surveys to see what the price ranges of products are in that locality or state. Looking at things like the BERFIS data to see what people are paying, and then sort of just building up that empirical evidence for why a minimum floor price would be beneficial, and sort of doing that groundwork before coming forward and trying to push the policy as having all the sort of ducks in a row on that.
Did you want to
add
anything to that?
I don't know that I have anything specific to add to what Derek said.
Okay, that's great. And then
I'll also say that there's a few comments around e-cigarettes. While applying minimum floor prices is more difficult to those products, certainly the ban on coupons, discounts, promotions can be applied relatively easily to e-cigarettes and have in the jurisdictions that have adopted them.
Great. I'll close with one more question, just asking for a source to find whether or not, if you have an idea of where folks could go to find whether or not there's minimum floor pricing ordinances in their area.
Great question. If your state has a statewide, robust statewide tobacco control program that is sort of tracking local developments, that is one way. As much as it pains us to do, industry also keeps track of all of these policies, and so we can look at their list to be useful. But beyond that, it's sort of there's no comprehensive accounting for jurisdictions that have adopted them, although there are some resources from the Public Health Law Center that go through a number of them, even if not being a totally exhaustive list.
Great. Well, there's a couple other questions, but I think due to our time, I'm gonna let Carrie close things out. But thank you so much for your thoughts on all those questions, and thanks to everybody for adding great questions.
I actually want to follow up with one more question. and this is just about resources. You mentioned several resources from Change Lab Solutions at the end of the presentation, but is there anywhere else interested coalition members can find information about your work, or any other resources you can recommend for coalitions interested in implementing minimum floor price laws in their community?
Yeah, I think certainly the other legal and policy technical assistance centers like the Public Health Law Center, Public Health Policy Center, University of Maryland has their center, and then sort of the voluntary health organizations also can provide resources as they work on these efforts as well. So heart, lung cancer, Campaign for Tobacco-Free Kids, sort of your usual suspects in the tobacco control space are probably the best bet.
All right, so thank you. So before we wrap up, I want to let everyone know about the next webinar in this series. Dr. Cheryl King will present on her recently published article, Emerging Trends in Adolescent Suicide Prevention, on September 9th. I'm really looking forward to hearing Dr. King speak on this topic. It's so timely, and adolescent suicide prevention is an issue that's really important to me personally. So I'm so glad we can have Dr. King on to speak about her article. More information will be sent out about this webinar next month, so please mark your calendars for September 9th. Next slide, please. As I mentioned earlier, I will distribute the slides following this webinar to those who participated, so you'll be able to access all those links to the resources mentioned. And that email will also contain a short evaluation for this webinar, so please fill it out. If you would like a letter of participation, you will see a link to view and download it from the thank you page of the evaluation. You must fill out the evaluation to get the letter, and you must download it right after you fill out the evaluation because you won't be able to return to that thank you page later. I will also post the recording of this webinar and the resources mentioned in the presentation and in the Q&A session on the CADCA website in the next week or so. And as a note, if you joined this webinar by phone only using the dial-in number, please email me today to get the evaluation and the slides and the recording because I only have record of your phone number, so I can't email you anything. And finally, thank you to Dr. Golden and Mr. Carr for their wonderful comprehensive presentation on your work and for your commitment to providing relevant and current material. And thank you to all the webinar participants for your comments, questions, and insights.